All right, this video is for tips and tricks on how to make sure you're taking your licorice root or other drops on time. The idea is not to be that we have to be perfect, but we want to try to be as close to perfect as we can, or in other words, do as best as we can. We know that we're going to miss some doses, but we want to try to do it as best as possible. So the idea is for the licorice root, which will come in a bottle LR Pro for licorice root, is you take the subscribed amount or recommended amount that is recommended by your, in this case, me usually, or another provider if you're working with somebody in our clinic. And that should be 1 hour to 30 minutes before, so 30 to 60 minutes before your lowest readings. And so that'll be described in your protocol sheet. It'll tell you how many drops to drink and when. You can take them, you can squirt them directly in your mouth. If that doesn't bother you, great, do it. That's the quickest, simplest, easiest way. I recommend setting a daily alarm on your phone that goes off every day. So if you're taking it 3 times a day, you would have an alarm at 8 a.m., 11 a.m., and another one at 3 p.m. So because those are usually right before, or maybe the 8 a.m. could be before because it's before your lowest reading. So if your lowest reading was at 8 a.m., then it might be a 7 a.m. or immediately when you wake up is when you take your first one. Your second one would be 11 a.m. because that's 1 hour before your 12 o'clock reading. And then the 3 p.m. is 1 hour before your 4 o'clock reading. Or if you did it at 5, we don't usually push it off till 4 because we don't like to take the licorice root much past 3 p.m. because it's too much of a bump for our metabolism because after 3 p.m. we're really starting to come down on the cortisol level, and licorice root will push that up, and so it's just doing the opposite effect. So set your alarm, squirt it into your mouth if that works for you. If that doesn't, there's a couple things you can do. You can certainly put it into a full bottle, however many drops you need into a full bottle, or if that's just too much water to consume, you could put in a small amount in an empty bottle like this. I'm going to do one for the 3 times a day that I have with my recommendation. Okay. And so I will have an 8 a.m. one, or as a awake. It'll be awake or 8 a.m. Then I'll have one at 11. I'll have another one at 3. And then what I do in the morning before I start my day, shake that up, put in however many drops you are prescribed. Most people are 8 to 10. And if you're at a half dose, then that might be 4 to 5. And you just put your lids on them. You can give them a gentle shake. Take it with you. And then when your alarm goes off, you're in your work day, a little alarm goes off at 11 a.m. You just start drinking your 11 a.m. Water bottle. Same thing at 3 p.m. So then you don't have to stop and try to measure out the drops. You're in the middle of workflow or driving, whatever your job is. Great. 11 goes off. Great. You turn off the alarm. You grab your 11 and you start drinking it and save at 3. So that's a little tip to make sure that you're always getting your licorice root within the time that you're supposed to. So if for the 11 a.m. example, you want to take it between 11 and 12. So you want to be done by 12 if you can, 12:30 at the very latest. If you're going after that, then you're starting to get closer to your 3 p.m. dose, and you don't want to do that. So if you're much past 1 p.m., then you might as well just skip your 11 a.m. dose if you haven't done it. And if your 11 a.m. isn't finished by about 1 p.m., then you're done. That's also another reason why you can put it in a smaller amount of liquid, because it's a lot easier to consume rather quickly. And same with 3. You want to really be done by as close as you can to 3. So if it's a small amount, you could down it pretty quick. 3:30 is fine. You want to definitely be done by 4, if not earlier, because if you're going beyond 4 o'clock and you're still consuming this, then you're going to have just issues with it's not really doing its job. Ideally, if you can just take it and you can squirt it into your mouth, however many drops you're supposed to have, great, do that. This is just an easy way so that if you're driving, it's kind of hard to stop and take your drops, or you have a very busy work schedule, you're on phone calls, meetings, whatever it is, well, you can just start drinking whichever bottle goes off or whichever alarm goes off at that time. So, little quick tip on how to make sure you're getting your drops.